Well, hi there, and welcome back. My name is Sheldon McLeod, and this is Thinking Out Loud, presented to you here exclusively by the SaltWire Network. And I invite you to find our YouTube channel. We have a brand new YouTube channel where you can see some of the great work my colleagues are doing. Like it, subscribe, and all the things that are accompanying that. And of course, we are where all your favorite podcasts are found. We certainly do appreciate that. This has been a story that really, it's heartening. It's disheartening. And this is something else that came from the story about Allison Holthoff. As we know, her husband, her widower, was in front of the media at Elizabeth Smith-McCrossin's office to talk about how his wife had passed away after visiting the emergency department. And he is a constituent of Elizabeth Smith-McCrossin's, the member of the Legislative Assembly for Cumberland North. And we've joined Elizabeth now. And good day to you. And how are you holding up?
I'm good. It's it's a challenging time, obviously, for my staff and I, but we're here to support the family through this situation. And obviously, they're under much duress and pain and suffering right now.
As an MLA, I'm sure you have people show up at your office often that have concerns or challenges, or they're looking for assistance or help. Can you talk me through how this one came to you?
So Gunter was Ali's husband, the woman that passed, and he reached out to me, I believe it was last Tuesday morning. I can't remember if it was through in what method, but he contacted my office and asked to meet. So we met that day, and he shared what happened. It was heart-wrenching. And I asked him what did he want? What did he want me to do to help him? And he told me, he said he wants an investigation and he wants changes so that the experience that he went through, that ultimately the result was his wife dying the same day that he took her to the emerge. He wants actions to be taken so that it doesn't happen to anyone else. So we immediately set things into action to try to accomplish that.
I've spoken with other MLAs who tell me there are areas of confidence and privacy when it comes to personal health. And, I'm sure you've had to deal with that in the past where there's confidentiality agreements and all of that. So how is this situation different than what you'd been faced with in the past?
Yes, absolutely. Every time someone contacts me, it's always confidential. Unless the person wants it to be shared publicly. And in this case, Gunter did want that. He wanted people to know what happened to his wife. He wants answers. And so that happened. And we sent a letter to the Minister of Health on Tuesday, the same day that he came to my office. My staff also called the minister's office requesting a meeting. And that didn't happen with the minister. So that led to another letter, a second letter on Friday. And the letter on Friday was posted after the funeral. And then that was shared by a lot of the community, because the community, in addition to Gunter contacting me, I had hundreds of people in the community contacting me saying, you need to help this man. And the community wanted answers too.
Well, and as people who are invested in their community by being volunteers with the fire department, and I'm sure they have lots of connections, whether they're related by blood or just through this shared space in which they live, something like that, no doubt, spreads quickly, and that people know what's happening. And as you say, this was after the funeral service. So when you took the decision to publicly post that letter, tell me about what brought that around, what it was that inspired you or provoked you to do that.
To do the letter?
To put that letter out on social media.
Okay, yes. So Gunter and had made it very clear he wanted an answer and he wanted an investigation. And we wanted to make sure the community knew that we were in fact doing that we were seeking an investigation and that we were seeking answers from the government. So by posting that letter, the intent was to let the community know that we were taking actions and trying to get some answers from government. So that was the purpose of posting it.
And I guess when, the story that Aaron Besrick has with a follow-up at saltwire.com is about this letter or this threat or this perhaps implied threat that you were somehow violating privacy. What went through your mind when you got that letter?
Well, I knew I wasn't. And the very first day when Gunter came to me, I did ask him to sign a consent, because that's what we do here in the office if people want us to take action. So I had a signed consent. I knew I had the permission of Gunter. So I wasn't concerned that I had violated the privacy. Of course, it's still disconcerting to receive an email threatening legal action, of course. And it caused a bit of stress here for my staff and I. But I did seek a legal opinion from actually 3 separate lawyers, and all did assure me that there's, in their opinion, that there was no breach.
As you point out, the information that would have been considered private were her name, where she died, and the date she died. And I don't know that, as you say, it was anything different than what was in the obituary that was published publicly.
Right. Correct. Yeah.
So,
and it's a distraction from what really we need to focus on, and that is getting an investigation done and getting some action taken to prevent this from happening again. That's where our focus should be. I understand people's interest in the email that I received from the Department of Justice threatening legal action. I completely understand that interest in that, but I'm hoping that the focus can get back to let's get some action happening to make some improvements.
And to be blunt, I, in many ways, felt that was an initial reaction, a gut reaction, given the comments in the media through Aaron Beswick's first story, which was, we don't comment publicly, that it was a Nova Scotia Health Authority edict or decision. I don't know what political involvement might have happened beyond that, but quite honestly, they said any reportable incident does launch an investigation. But the question was, who is it reportable to? And the public didn't really know about this outside of a group of family and friends and community members. So, Elizabeth, what is your thought on the perhaps responsibility of the government to be open and transparent when something like this happens, balancing that with the privacy of medical information?
Yeah, I think that the government has a responsibility to come out publicly and show compassion. Clearly, it's very obvious through social media that there were hundreds, if not thousands, of people very upset about this situation. And just acknowledging that a death occurred and that and showing compassion and caring is the very first and most important step. And then taking action, following up. No one's actually met with the husband. That's what I would recommend. When I say no one, I mean no one from Nova Scotia Health or the government that's responsible for healthcare. I think he deserves answers, and he deserves compassion and caring, and that's really where things should have gone, versus trying to silence people and silence the community. As you know, Sheldon, I'm an independent MLA, and I was talking about it with my husband this morning and said, you wonder how many other MLAs in their job are silenced because of political affiliations. In this case, I answer to my constituents, and I guess maybe the only way of possibly trying to silence me was threat of legal action. But really, as politicians, as elected officials, our focus should always be on serving the people and not protecting messaging or trying to silence when there's an issue. We should be focusing on addressing the problem and coming up with solutions to fix it. And in this case, we're dealing with life and death. We've been trying to sound the alarm bells up here in Cumberland for a few months. Dr. Scott Bowen, you may have seen a story in the front page of the Chronicle Herald actually back in the fall, where he's the chief of our ICU. And he contacted me to say, please help. We need more nursing staff. We're running our ICUs on 50% capacity of nursing. It's not safe to patients. When I brought that up in question period, it was not received with respect. And to this day, the minister has not come to Cumberland to meet with Dr. Bowen and the other medical staff and nursing staff. So I think we need to always remember why we're here, focus on the people, focus on the purpose, and put aside political partisanship for the greater good. Anyway, that's my little spiel.
Well, no, to that end, Brendan McGuire, the Liberal health critic, amplified that letter, amplified the message, saying that this is healthcare. It shouldn't be political. But we're at a time where we've seen an evolution. There was a point in time where local media, when there were many more of us, could go to a health board meeting to hear what was happening. There's now a CEO, Karen Oldfield, who's responsible for all of the operations, who has, at a public accounts committee meeting, said she's very interested in making sure healthcare is available for the people where they need it, when they need it. At that point, she was talking specifically about access to surgery wait time. But what, if any, responsibility do you think the CEO of the health authority has in making sure there's confidence in the system, given that this government was elected to fix healthcare and something as tragic as this can happen?
Yeah, well, it is the CEO's responsibility to make sure in any healthcare system, it's the CEO's responsibility to ensure that there is effective, solid operations of the healthcare system. It's no secret that I have called for a change in the position of CEO, no different than what the Premier called for back when he was leader of the opposition, when Premier McNeil had a board of directors running our healthcare system with no doctors and nurses on it. So back in those days, I had put forth a bill, which Premier McNeil actually did take action on and put healthcare professionals on the health board. So in my studies, over the years, I believe we need a model like the Mayo Clinic, where the CEO of the healthcare system is a medical professional, someone who understands healthcare, who has education and expertise. In healthcare, you don't know what you don't know, and it's just that simple. And it's very important that we have people that are in leadership positions that have the education and expertise as well. And the other thing that I've asked for is to bring back local decision making. So each regional hospital should have its own CEO that is responsible for the operations and management of that regional hospital. And right now you have people, good people working in Nova Scotia Health that are trying to operate several regional hospitals. It's just not possible. It's not effective. We're seeing the results of that, I believe, right now. For example, here in the northern zone, they're responsible for Colchester, Cumberland, and New Glasgow. And it's too much to manage for one. Each hospital should have its own CEO that is accountable and responsible for the management of that hospital. So bringing back a local decision-making, possibly even local health boards, will help give communities a voice. And, right now, if someone comes to me like Gunter, I have to contact the minister every time. So there's no local CEO that I can go to. Mm-hmm.
I did have an opportunity to speak with Minister, and Minister Thompson says that she is open to a meeting with Gunter. I'm not sure how that would be facilitated, and I'm not sure if it was just the days of and the initial shock of this whole story, but I'm sure you're not going to give up in making that happen. And I guess outside of trying to systemically change the way that the health system is managed and operated, what is the call to action, Elizabeth? Where do you see constituents, people who are frustrated, who have perhaps lost their faith? I know the minister was very clear, and I think you would probably agree that if you're sick, Go call 911, go to the hospital. It's the expectations that need to be managed here. So going forward, what's the call to action? What do you feel needs to happen given this tragedy?
Yes, so thank you for asking that. We have a 7-point action plan that we did send to the Premier and copied the Minister yesterday morning, and they're all action items that have come from Gunter himself, as well as family and community and healthcare workers that have been contacting me. And we believe if these 7 points are implemented immediately, that this will possibly prevent future deaths. So the very first one, I didn't realize this until after we had sent it to the Premier. It's actually something Premier Higgs next door has already implemented, and that is to have a healthcare professional oversee the waiting rooms. And right now, we don't have any oversight. So our triage nurse, our triage room, does not allow to have eyes on the waiting room. So if someone's medical condition was to deteriorate, it's not necessarily going to be caught in time. And so we want to have that happen. That could literally start today. And there are healthcare professionals available that would be skilled in being able to provide ongoing medical assessments. So having somebody in the waiting rooms of our emergency departments is number one. Number two is more specific to Cumberland Regional, and that is get our main ER open. Our main ER flooded in May, and the reopening dates keep being moved. And yesterday, in one of the releases from Nova Scotia Health, there was no change. They're still saying mid-February. Well, when the flood happened in May, they said 8 weeks. And here we are. It's still not open. And the fact is the healthcare professionals are working in very challenging conditions. And if you listened to Gunter's sharing yesterday, you would have heard some of those examples. So we want people, construction workers, plumbers, whatever they need to get it done. And if anyone listening's been involved in renovation projects or construction projects, there's 24 hours in a day. Get people working there 24 hours a day until the work gets done, and get that reopened as soon as possible. Make it urgent. There's no sense of urgency or accountability, it seems, to the taxpayers here. So that's number two. Number three is to immediately appoint a patient advisor to help support Gunter, his children, and any other families that may experience an unexpected death in the ER. The ministry should appoint an advisor that would be there to support, educate, and answer questions so that he doesn't have to go to media or an MLA. Number four is to provide safe staffing levels in the ER, recruit nurses, offer nurses full-time positions, and incentives and bonuses. And the reason I specifically say that is last fall, we had a call. I put out a call to action to the community, say we need nurses at our regional hospital. If you know of anyone that may be living away that might consider coming back, please contact them. Let them know. Well, we had people do that. And when they contacted Nova Scotia Health, they were told there was no full-time positions. So on one hand, there's a nursing shortage, and they're saying we need nurses, but they're not offering nurses full-time positions or incentives. I mean, if you're going to recruit, you have to make us look, it has to be a good place to go. If nurses are working full-time hours, but only having casual positions, it's not right, and we're not going to recruit them. So that's number four. Number five is to have a walk-in clinic adjacent to the emergency room, at least 8 hours a day, 7 days a week. So when you're triaging, it's a 1, 2, 3, 4, and 5. Your 4s and 5s are your sort of non-urgent things, but still need to be seen. And as you know, there's so many people, 15% it looks like right now, of people in Nova Scotia without a family doctor. They have no choice but to go to the ER to obtain even basic primary health care. Set up a walk-in clinic so that the number 4s and 5s can be seen, but are not contributing to the congestion in the ER for emergency situations. Number 6 is post the wait times for EHS and ER wait times online, real time. You may have heard Gunter say that his wife had collapsed on the floor in pain. He made a decision to not call 911 because of a previous experience that they had in September where they waited over 3 hours. And he's also aware of other situations in the community where ambulances have not showed up and not been available. So post those times online so people can make educated decisions. Other provinces have done that. Alberta does that. They post wait times online. And number 7 of the 7-point action plan is for EHS to partner with local fire departments and other first responders to work with them to ensure that people can get to the hospital in urgent situations like this. You may have seen that literally while Allie was dying that night, I was dealing with 2 other families that were trying to get an ambulance and couldn't. One was trying to get to Halifax for life-saving surgery and wasn't able to get there. And another one, her mother had a broken hip. And you may have noticed in the newspaper, in your paper today, there's a cartoon, and I'm sure it's from a reflection of that story. She's an employee at a local funeral home, and after waiting five plus hours and still no ambulance, they made a decision to transport her mother with a broken hip on a stretcher and vehicle from the funeral home. this is not acceptable. This is not acceptable. And we have partners with local fire departments that want to help and are more than willing to help. Someone with the fire department in Tidnish at Allie's funeral, they told me that when they transported her, so they did help in September when she fell from a horse, they transported her with the fire truck then after waiting 3 hours, and they were chastised. They got in trouble for doing that. Well, let's stop doing that. Let's start working with the people that want to help and make improvements. So Sheldon, that is the 7-point action plan that could be implemented right away. Just so you're aware that we do have more. We do have 8 or 9 more recommendations, but we want to see these 7 implemented first, and then we can give more suggestions as well.
Elizabeth Smith-McCrossin, I know there's lots more to be said. I know we're going to follow up on this, and we'll keep in touch and we'll keep in contact. I have a request in to speak with the CEO, Karen Oldfield. I will very much be looking forward to hearing more from you. And thank you so much for what you've done and for keeping this issue top of mind.
Thank you for giving us a place to share Gunter and his family's concerns. It means a lot.